Hi anatomy students, this is Dr. Ollis. In this short video, we're going to talk about the three main kinds of skin cancer, as well as how we can stage the kind of skin cancer known as melanoma. When we talk about the three main kinds of skin cancer that we see, it all comes down to where those cancers started. When we talk about a cancer that starts in the level of the skin known as stratum basal, we're talking about a kind of cancer known as basal cell carcinoma. Basal cell carcinoma is the most common kind of skin cancer. This is also the slowest growing form of skin cancer. When we look at the way that a basal cell carcinoma grows, it grows uniformly down from the epidermis layer into the dermis. Basal cell carcinomas are slow-growing cancer, and they have this uniform growth pattern in the bottom. Based on that, they're also one of the most treatable forms of skin cancer. The next kind of skin cancer that we see, getting a little bit more serious, a little bit faster growing, is what's called squamous cell carcinoma. Squamous cell carcinoma is a skin cancer that starts in stratum spinosum of the skin. This is a layer in the epidermis where you can see the squamous shape of the cells very clearly. So if a keratinocyte that lives in stratum spinosum becomes cancerous, maybe because it was exposed to UV radiation and its DNA got mutated, if that cell becomes cancerous, we would call that a squamous cell carcinoma. The challenge with squamous cell carcinomas is not only do they grow more quickly than basal cell carcinomas grow, they also grow less uniformly. So notice how the edge on this tumor is a little bit less well defined compared to a basal cell carcinoma. It's going to be a little bit harder for a dermatologist that's trying to remove these cancerous cells to make sure that they get all of them when they're excising the cancerous tissue. So squamous cell carcinoma is a little bit more challenging to treat. The most aggressive and most challenging skin cancer to treat is called melanoma. Melanoma, like its name suggests, is a skin cancer of the melanocytes. Remember from our discussion about melanocytes that their job is to make melanin, that color-producing protein that we find in the skin. Melanocytes are really good at making melanin, but that melanin that they make, they often give away to all the other keratinocytes in the epidermis. Because of that, melanocytes are more susceptible to having their own DNA damaged. Melanomas are a fast-growing form of skin cancer, and like squamous cell carcinomas, these cancerous cells don't grow down into the dermis level uniformly. And melanoma has this tendency to spread to other parts of the body. In a moment, we'll talk about how the places it's spread to can be used to give us an idea of what stage of melanoma we're talking about. Before we talk about staging melanoma, let's look at actual patient pictures of the various kinds of skin cancer. When we see a basal cell carcinoma, notice how there's a pearly appearance to it. This kind of skin cancer grows slowly in areas typically exposed to sunlight. Squamous cell carcinomas tend to look a little more ulcerated or a little bit more raw. These types of skin cancers tend to grow down as opposed to out, like in a basal cell carcinoma. And of course, a melanoma, the way you'll identify this kind of cancerous lesion is the dark color that we see here. It's dark because the cell that's rapidly dividing more than it should is a melanocyte, the cell that makes melanin. This cartoon was pulled from the internet. You don't have it in your notes, but I do want to point out, as a fun representation, we have the two more common forms of skin cancer. Basal cell carcinoma, which we talked about being the most common type, the one that grows in this pearly appearance. Basal cell carcinomas grow more slowly, and they grow in areas that are exposed to the sun. That's generally true for squamous cell carcinomas as well, but remember that these can grow more quickly or be a little bit more aggressive than a basal cell carcinoma. And again, they look a little bit more ulcerated. They're a little bit more ugly, if you will. Basal cell carcinoma and squamous cell carcinoma, the two more treatable types of skin cancer. Melanoma is the most aggressive form of skin cancer. And remember, melanoma occurs when the melanocytes that we find in the epidermis become cancerous. When we talk about staging melanoma, it's all based on where that melanoma, those cancerous cells, have spread to. My fancy medical word for cancer cells spreading to another part of the body is metastasis. When we stage a cancer, we're wondering how far has that cancer traveled or how far has it spread. In a stage 0 melanoma, those cancerous melanocytes haven't spread anywhere. They're still in the epidermis. Best case scenario, if you were to develop a melanoma, you'd want to catch it when it's a stage 0. It hasn't gone anywhere in the body. If you develop a stage 1 melanoma, those melanocytes have left the epidermis where they started and gone into the papillary layer of the dermis, that upper layer of the dermis. If they make it down as far as the reticular layer of the dermis, now we're looking at a stage 2 melanoma. By the time those cancerous melanocytes make it down to the hypodermis layer of the skin, we're now looking at what's called stage 3 melanoma. The problem with stage 3 melanoma is not so much that the cancerous cells have made it to the hypodermis, as much as they're likely to have gone inside the lymph nodes that are found in the hypodermis. Lymph nodes are part of the lymphatic system, which is kind of like the superhighway system that runs throughout your body. If cancerous cells make it to the lymph nodes, there's a very good chance that they're going to travel to other places in the body. So in a stage 3 melanoma, melanocytes are found in the lymph nodes that are right next to that original cancerous lesion. Stage 4 melanoma is what you might call terminal melanoma or end stage melanoma. In stage 4 melanoma, we start to see melanocyte cancer tumors popping up in other organs of the body. So a different place in the skin might develop a melanoma tumor, or places like the liver or the lungs might have cancerous melanocytes that are growing a tumor in these places. In stage 4 melanoma, we have metastasis to many different places in the body. Again, this is the latest stage, the most aggressive stage of melanoma when it's spread to other places in the body. You have this table in your notes reminding you to stage the melanomas based on where they've traveled to. Remember, if a melanoma never leaves the epidermis, it's found in stage 0. We'd consider it stage 0 melanoma. But when melanoma, those cancerous melanocytes, have gone to other organs in the body, made tumors in new places, that's considered stage 4 melanoma. So remind yourself as you're staring at this chart, what stages are in the papillary, reticular layers of the dermis, as well as that lymphatic system. I'll leave this table to you.